Call to order. We have two items that we have to discuss and make recommendations on. We do have a person to speak, and out of courtesy to them, we'll allow them to speak first on the two items. They must be familiar with them. Mr. Bernard Friday. You may speak, sir. Oh, you have 3 minutes.
Good evening, Superintendent Rowland, ladies and gentlemen of the board. I rise today to speak on behalf of the motion to adopt the resolution authorizing the CFO of the Bossier Parish School Board to adjust the premium costs, so on and so forth. Well, tell a story. Well, let me back up. I am a member of Red River United, representing over 3,000 teachers and school employees in Caddo Parish, Bossier Parish, Red River Parish, and DeSoto Parish. So just a few months ago, we had a battle across the river. Caddo CFO said we needed to raise insurance premiums 15%. We need to double out of pocket, double deductibles. Now, this is right before Christmas. What a Christmas present for the teachers and school employees, you know. Through the use of and efforts of retired employees, retiree committees, current employees and organizations, we were able to come up with a solution that was quite a bit more palatable for those affected by the increase. Only 7%, no double deductibles, no double out of pockets or whatnot. Now, I tell this story to emphasize the importance of shared decision making on any increase. Shared decision making, that model would be beneficial to all affected on any increases, especially when it comes to a benefit. You can't call it a benefit if you can't afford it. Now, I know that the CFO is more than capable from observation, but for the sake of transparency and for the sake of preserving the fiduciary responsibilities and duties of the board, I say let's gather input from those affected by the decisions we make, and let's continue to bring those decisions to the board. Thank y'all for hearing me.
Appreciate it. The item to which he was referring is item 1, and it says request motion to adopt the attached resolution authorizing the Chief Financial Officer of the Bossier Parish School Board to adjust the premium cost of the self-funded preferred provider organization plan, PPO plan, paid by the employees and retirees of the school board effective July 1st of each year, when the expenses of the current year associated with the PPO plan are more than the difference between the income and that. I think everybody is familiar with that. I just spoke to that first part. Are there any other comments relating to this particular item 1 from any of the committee members?
Mr. Chairman, I make the motion that we had tabled this motion at our last meeting, and we need to bring it back off the table. So I'd make a motion now that we bring it off the table for discussion and action.
Okay, there's a motion to bring it off the table.
Second.
For further action, there's a second?
Second.
There's a second. Ms. Poole, all in favor?
Okay.
It passes. So, you have further comment?
If I'm hearing correctly, and I've had some individuals reach out to me, the only real concern I have heard, save in one instance, is that we were granting authority to our CFO to just automatically make the necessary adjustments each year. And the reason and what prompted that was the fact that much like the situation we find ourselves in today, it has occurred numerous times over the last years whereby the premiums do not get adjusted this year or last year or whatever, and we're running at a deficit. Consequently, then we start stacking one year on top of the next. So instead of maybe a 2 or a 3% increase, all of a sudden we're looking at an 8 or 10% increase. And we passed something similar to this years ago. Why it is not in the minutes, I don't know. It's not in the minutes, so it's not there.
Right.
But I've talked with members who were here. We remember it. Mr. Chairman, yourself and I, we've talked about this. We had a discussion about it. My concern, and I was the reason for this resolution, was we are a self-insured health insurance plan. We have a Cadillac of a plan. I think, is Jason Allman here? Hey, Mr. Allman, if anybody has any questions about our plan compared to other plans, school plans and otherwise, we'll bring him up. And he's going to point out, we provide a Cadillac of a plan. And we want to do that because it is of huge benefit to our employees and even more so to our retirees. If you don't believe it, get old and start getting sick. Mr. Chairman, you and I both we know what that brings about. Yeah. But we have provided both for our current employees and our retirees and provided for them well. But we have a responsibility to ensure the ongoing financial viability, the solvency of this fund. And in order to discharge that responsibility appropriately, we have to make sure that our premiums satisfy the expenses, the claims. To do otherwise, we're not doing our job. We just absolutely have to. So that's what prompted this. Let's try to have it set up so that we don't run into these multi-year increases. We do the smaller incremental increases which reflect or decreases. We have had years, not too many of them, but there have been some where premium income surpassed claims. And when that's the case, fine, we adjust down. But we've got to get on top of this thing more so than has been the case in years past. There seems to be an issue with the CFO being delegated the authority to make the change on her own. She has to report it to the board, but unless it hits 10% or more, the board's out, doesn't necessarily act. I have no problem making an amended motion whereby we just say we will direct the CFO to perform the necessary steps to provide us with an indication of what premium should be, increase or decrease, for the upcoming fiscal year. And she then brings it to the board, and the board then votes. She doesn't make the decision, we make the decision. But the bottom line is, it's on the record, it's in the minutes. She knows, she is on notice. Every year, you are to whom she might delegate the responsibility. They have to do it, they have to come to this board, and we then have to take the steps necessary to adjust premiums and thereby ensure continued viability, financial viability of our self-insured plan. So I will do whatever. My concern is the ongoing solvency of this health insurance plan. We must perform our fiduciary responsibility, and that is do what's required to keep it solvent. to do otherwise, then we are really doing a disservice to our employees and to our retirees.
The motion you just made sounds pretty decent, but any more comment, any other comments, or, yes, sir?
Ms. Bamberg, we're absolutely positive that going to the employees and the retirees and raising their premiums is the absolute only way to get us out of the red. Or the best way. I won't say the only way. I'll say the best way, in your opinion.
That's probably getting more into the second item instead of the first. If we're talking about the rates that we're fixing to discuss for this year right now, we're probably talking more about the second item instead of the resolution. The resolution would be more going forward after whatever happens tonight. But if you want me to skip ahead to that, there are other options. The other options are not as palatable, and they don't necessarily preserve the benefits to our employees. And that would be our biggest concern. But being able to raise the premiums, and we'll go into it, and then we can go as in-depth or not in-depth as y'all want to. We have done so much on the back end to try and increase rebates. We've implemented new programs. The Save On Rebate program, we can tell you about that we've implemented. We've tried all other external revenue sources that we can get coming in to try and help. The board approved the closed formulary. That helped try and close off some of the costs. But we have drugs that we pay every month, that we pay the bill for, that could be $30,000, $40,000, $50,000 a month. We have those. And when we have bills like that, it just inherently, I calculated it, and the cost has gone up about 37% in the last 4 years. When you're looking at a 37% increase in cost, it's just a certain point you hit. So I can tell you right now, what I'm going to ask for tonight, that's not going to fix everything. It's not. But it's starting to get us in the right direction, and it's trying to follow the request of the board last year that we do the small incremental increases, and we adjust it each year instead of, like last year, we did a 9% increase. We wanted to start doing slow adjustments to get us more in line. I don't want to ask this board for a 30% increase. I don't, because we are trying every other way we can to help bridge the gap. But I do, honestly, out of my heart, I feel like it's the decision we need to make tonight. And it's not something that I take lightly. I pay the bill too, you know what I mean, personally. So I hope that answers your question, Mr. Bachhaus.
Since you brought up the drug programs, are we getting rebates back this year for some of the things we approved last year?
Yes, sir, absolutely.
And can you give me a pretty close amount to how much we're getting back?
Absolutely. Do you mind if I let Mr. Alleman speak?
Not at all.
Good afternoon. Yes, last year we implemented, effective January 1st, a Save On program. And under the Save On program, we access all the money that's possibly out there on specialty drugs from the drug manufacturers. In some instances, it can be 20 or 30%, $25,000, $30,000 a year on one particular drug. So far on the first 2 months of the year, January and February, the net savings to the plan has been over $80,000. So in essence, $1 million savings over the course of a year. And it's just rolling out. So somebody taking a specialty drug, those are biologic, generally in nature, Humira, Enbrel, things like that, where people are getting it. It's a specialty drug. They cost $7,000, $8,000, $10,000, $15,000 a month. We're able to access manufacturers' cost sharing amounts. So rather than the person having 10% up to a max of $150 on the individual, we removed all the responsibility on those drugs from the member. But we go after all the money that's available from the drug manufacturer. So if the drug manufacturer will give 25% of that cost of the drug, we adjust the copayment to 25% of that cost of that drug. We protect the members so they don't have any out-of-pocket, but we get the maximum we can from the drug manufacturer. And so far, it's been about $80,000 a month.
About how much?
80.
$80,000 a month?
Yes, sir. We have increases in costs going on all the time, and And, you know, Ms. Bamberg, Mr. Rowland sat in a meeting that we sat in with Blue Cross, and the meeting lasted, oh gosh, probably 2.5, 3 hours, and we went through all the costs of the program and explaining where the costs are. I mean, drugs that didn't exist 3 years ago, we're now spending $2 million for, okay, in the form of these diabetic medications. They're $1,000 a pop. We're getting back about 50% of that in the form of a drug rebate. So our drug rebates have shot up tremendously, over $1 million in a 7-month period of time. But unfortunately, our cost of our drugs are going up. So we're getting more, we're accessing everything we can. You know, this plan is very simple. It's a self-funded plan. The cost of the plan, you want lower costs, people have to have less claims. Otherwise, there's only a few sources of revenue that come into the plan. There's the amount y'all pay 80% of the cost. And the employees pay 20% of the cost for their coverage and for their dependent coverage, okay? And from there, we go to rebates, we go to these save-on programs that we try to get other revenues into the plan. Reinsurance comes into the plan. But there's a very finite number of revenue sources that we can put into this. Without having lower claims, the cost has to go up, whether it be all on y'all's side or all on their side. And like Mr. Bullard said, there was a resolution that was passed, I think it was either 2007 or 2009, that was ratified by the board, that here are the percentages, and as necessary, that we give them permission to increase these rates. Now, many years we've worked and we've managed things to keep costs down and work through it, and we've not had any increases. And then for a string of years, we made an increase in 15, and then we didn't need one. And in fact, in 19, we gave money back. And when we're talking about a 5% increase per month this year, we're talking about $5 or $6 a month for an employee-only coverage. Well, we gave back 3 full months of premium back to people. So if they were paying $100, we gave back $300 to people out of the fund. Nobody's taking this money home. This money is there for the benefit of the employees, and we're just trying to make sure it stays solvent. And I hope that answers your question.
Certainly does. Thank you very much.
Any further questions?
Mr. Chairman, I'd like to apologize for being late to traffic, and I know that's no excuse. But did I miss something? Because I believe Ms. Bamberg referred to the other part of this. Are we dividing this?
It's two separate items right now. The first item is the
Okay.
resolution.
Right.
All right.
No problem. The first item is the resolution, and I did want to clarify one thing, Mr. Bullard. We did add into the resolution a comment that I can't increase the rates without the superintendent approval. So I did want to point that out. I don't want anyone thinking that I'm doing it in the back office by myself, not telling anyone. So we did make that adjustment. Mr. Rowland does have to sign off on that, and Mr. Rowland and I are both very committed to, if this resolution is the board's desire, that every year we still will stand before the board and present all of this for discussion. We will keep the board fully informed of what we're doing. None of this will be done without coming into this public setting to discuss it with the insurance committee. So those are two things that I did want to make sure and point out. But again, whatever the board's preference is on this item.
Committee members, I commend Mr. Buckhouse and Mr. Bullitt. Mr. Bullitt, the recommendation we were making relating to keeping the final word with the board, I think is a good one, if you'll make that motion, as you stated earlier, if there's no other comment. Yes, sir.
Like I said, I apologize for being late.
Not a problem.
And I missed this. I feel like I almost missed a meeting. But did we have any meetings educating us on this that I'm not aware of? Anybody? No meetings?
One meeting to which the gentleman referred, the president and I were there for that 3-hour meeting for that.
Okay.
We were there, but other board members were not.
I got the impression that people that were for this program had a meeting today
Today?
that only several people that was for the program attended, and I don't know anything. Did I miss something else besides that meeting?
Yes, sir.
No, sir, go ahead, Mr. Rowland.
Mr. Superintendent.
Mr. Chairman, thank you. Captain, we had a meeting today, but it was to discuss RFPs for our auditors, whether it be school activity fund or the district as a whole. That was our meeting this afternoon. And we did have
Can you tell me who was at the meeting? Who was invited to the meeting?
board president and Mr. Bullard.
So it had nothing to do with this?
No, sir.
Thank you, Mr. Superintendent. Mr. Burley.
Mr. Chairman, I will make a motion, and Mr. Self, you will probably need to put a little legalese and gild on it, but I think you'll get my purpose or intent. I'll make a motion that the chief financial officer be directed to come before the board with a recommendation for health insurance premiums for the upcoming year based upon the claims and premium experience from the prior year. And the board, and she will do so within a time frame that will allow for discussion, consideration, and notification of all employees and retirees of whatever action is taken. We don't wait till the last minute and next month we've got to make the change. She knows what the time restrictions are, so her report is prior to the time frame that would be required. And the board would then approve or disapprove whatever adjustment, be it up or down, is necessary to maintain the viability of our self-insured fund.
Did someone say that Mr. Self has to legalize, do some legal work on this motion?
So just, if I get what you're saying, or I hope I do, is that essentially we want Ms. Bamberg to come up with the proposed adjustment as is in this resolution, but the final adoption of it would be subject
Yes.
to board approval.
With the board.
By the committee and the board,
Yes.
yes.
And it would be in a timely, pardon me for interrupting,
Yes,
sir.
no problem.
If it would be in a timely fashion. She's aware of the restraints that she must function within. I believe she needs 60 days prior notice, I believe. Is that correct? And, but, so.
I want to give the employees a 60-day notice. So we want to be able to give them a 60-day notice, so I would need to start probably 60 days before that, so that we can have time for your discussion and consideration.
Would it be appropriate then to say 90 days prior to implementation, you will report to the board?
Yes, sir.
Okay. Got a second on that?
Question, so we're giving the board the authority, not Ms. Bamberg?
The board will have the
The
authority.
authority
yes.
for the
Yes.
transparency, which I do appreciate the comments that, of that side, and Bernard, Mr. Bernard.
Do I
but,
have a second?
Yeah, I'll second it.
Okay. It's been moved by Mr. Bullitt and second by Ms. Poole that we accept the recommendation, the motion of Mr. Bullitt with the caveat of the legal part that has to be input into it.
Don't ask me to repeat it.
Not a problem. As our new standard, giving the board the final say in matters such as this. All in favor? The committee approves. Thank you very much. Item number 2 is request for approval of health and dental insurance rates. That was going to be, I think, an upper mobile item, and it's been tabled. We'd like to keep it tabled. We've got something to work into an option other than passing on the costs to our employees, but the pleasure of the committee is, if anybody has any comments on that, different from leaving it as a table item until the next board meeting. Yes, ma'am.
do know that we tabled this the last meeting, and I mean, I think that we need to have Ms. Bamberg do her presentation of what deficit we're looking at. And I believe that if we come to the conclusion that we do need to increase the rates, if something happens, and the wheels turn very slow that you're discussing, if they turn at all. And I believe that it would be in our benefit to discuss this, listen to what she has to say, make a recommendation, and then we could adjust it if needed, like we did in the past.
Thank
With
you, Ms.
excess
Smith.
funds.
Wise people say, where there's a will, there's a way. I would prefer not a dime be passed on to our people, our employees, in raising premiums, unless there's no other option. I'm saying there is an option. Whether or not we can achieve it or not is a different story. I think we can. We need a little more time to try that option. Then nobody will have to pay anything. But if we can't do it, then we have. So if we leave it until the next board meeting, then at that point in time, we'll have to make a decision. But that's my opinion. Any other discussion? Ms. Bamberg, you want to have something?
Oh, I'm sorry, just for clarification, was this an item that was tabled at the last meeting?
Yes.
Then just procedurally, if it stays tabled through this meeting, it dies, so what we would probably need to do procedurally is take the motion off the table, and then we can just postpone it till the next meeting.
Okay.
Thank you.
Do I have a motion to take it off the table? Yeah, sorry, go ahead. Yes, go ahead.
First question, I know we tabled it. We were going to allow you, Mr. Wiggins, to try to talk to a few people. Is there any update in that status of any of the connections you made?
I can't discuss it because there's nothing firm and concrete, but the things in the works that we have an opportunity to get it done. And the option is there if we can achieve it. We just need a little more time.
You just need a little more time?
Yes, sir.
Okay, my next question, I guess, would be for Ms. Bamberg. I know prior to me being here, I believe at one time you did an audit where you found that we had numerous people on our policy that really didn't belong on our policy.
Yes, sir.
When's the last time we did that audit?
We've done them twice. We did it once before I got here, and then 7 or 8 years later.
So we did one in 2013, and we did one in 2020?
Yeah, in 2013 and then in 2020. It's called a dependent audit, but basically they go in and look at every dependent, which includes your spouse or your children or whoever. And so we did the last one in 2020, and that's what we've been kind of committed to, is every 5 to 7 years doing that again. It's a pretty extensive process as far as cost to benefit. It's a pretty relatively low cost for the benefit. We typically save about $200,000 a year when we do it.
Gotcha.
So, and it does help. Well, we have done those kind of things, like Mr. Alleman was saying, we've done the Save On program. We've done additional rebates. We did the EGWIT program. We've implemented several additional cost-saving measures over the last just 4 years that I've been here. And there were several done before that. We really are trying our best to get the cost down as much as we can, but when you're looking at a 37% increase in expenses with a 18% increase in revenue, it just doesn't equal out.
I got it.
Great.
Thank you.
Yes, sir.
Committee members may I have a motion to untable the current number. Yes, ma'am. You making the motion?
Make a motion to bring the,
Do we get a second? Then a second to remove from the table item number 2, and a motion and a second. All in favor? Okay. Is there any discussion on this item before we try to retable it?
Ms. Bamberg, do you have a presentation to talk about what this?
Yes, ma'am.
Could you, for information
Yes, ma'am.
and
I
clarity
do.
and transparency?
Yes,
let
ma'am.
us-
Stuart, do you have that available?
And I'd like to see how that would impact the retiree
Absolutely.
premiums as well. Do you
Absolutely.
have that?
All right. So basically what we were going to look at tonight is just a few of the trends and then kind of what the impact we see on the rates would be. Stuart, if you can,
We can. I think we can.
there we go. I was going to let Mr. Alleman talk about a few of the statistics that we're looking at on the plan, just to kind of give you a history on how the plan has grown.
So with the health insurance plan, we've got medical and we've got dental. The medical plan, the board pays 80% of the cost, the members pay 20%. There's about 8,300 members covered, and members are belly buttons. We've got about 4,100 active employees or retirees that are covered underneath the program. Retirees wind up being about 1,300 to 1,500 retirees that are covered under the plan. The vast majority of them have Medicare and or Medicare primary, and those people do not pay a premium for the health insurance benefit for themselves. They do pay some portion of it for dependents. But active employees and retirees without Medicare pay a percentage of the cost as we pass it along. The dental that is paid for about 50% by the employee and 20%, and the dental program has worked pretty consistently over the years and has somewhat in past supplemented the medical plan in some of the shortfallings. Inpatient claims earlier this year were up 39%. This is something that's happening across the board. It's not just the Bossier Parish School Board, and I can't honestly tell you why, whether it's a hangover from COVID, or people just getting things done where it's an inpatient basis, or it could be a problem with COVID that caused some additional problems, or the vaccines. But we're seeing a 39% increase in inpatient stays, just that portion of it. That typically has the biggest volume of claim dollars per incident, but less incidents. Outpatient has about the same volume of claim dollars, but a lot more incidents. And then professionals about a third of the medical cost as well. Pharmacy cost is projected to be about $19 million for the active employees. Now, we're getting back about 42 cents on every dollar we spend on pharmacy in the form of a rebate. And this year it should be over $8 million. So far this year we've got back $4.3 million on the plan in the form of a rebate. So 42 cents of every dollar we're paying out, we're getting back in the form of a rebate. There are currently about 11 members, and this is on a rolling 12 basis, that are over 300,000. The board holds the first $400,000 on all claimants, okay? So every claim that's below $400,000 the board holds. After it hits $4,000 in the calendar year, the contract year, the reinsurer picks up. That's the only reinsurance protection we have. Overall claims are up 7%. They have improved through March a little bit. This was initially a slide put together for March 7th. Now here we are April 4th, and we've gotten claims data in from March, so it's improved a little bit. There are 108,000 scripts filled per year underneath this program. 85% of them are generic, about 15% of them are brand name drugs. The average cost of a brand name drug is over $1,000. Average cost of a generic drug is about $20. I'll turn it back over to Ms. Manberg.
We just wanted to show you some of the trend. As you can see here, the revenues are in the yellow, the expenses are in the blue. Even though we are seeing definitely an increase in the revenue with the premium increase that we were able to pass, as well as the increase in the rebates, the EGWIP program and the other areas, so this is not all premiums. We have seen an increase in our revenues, which is great, but as you can see, the expenses are still surpassing our revenues right now. Revenues have gone from about 50 million up to about 59 million in a 6-year period. Expenses have gone from 46 million to just over 60 million in that same time frame. So pretty significant increase in the expense side. Again, we just wanted to show you what we've been working towards, the reinsurance. We are pulling that in as much as we can. The refunds and the rebates, that's going to be coming through the EGWIP program. You can see a pretty good increase there. And so we're trying to maximize the rebate programs as much as possible. And then the next slide again is just kind of showing the trend in the cost. And so what we're coming and asking tonight, our proposal is a 5% increase effective July 1 of 2024. And we would ask for that to be across the board for health and dental. On the next slide, I'll show you This would be the effect on the actual rates for the employee. This is not the employer portion. As Mr. Allenman mentioned, we are 80-20 split, and so the employer, the school board covers 80% of the cost, and so the employees cover about 20%. So for your employee only, the old rate was $111.24. They would be looking at going to $116.74 with this 5% increase if it were to pass. And so the proposed increase would be $5.50 a month. Employee and spouse, employee and children, you're looking at about a $15 increase per month. And then the employee and family, of course, is your largest rate. And so the old rate was $463.52. The new rate is $486.70. And so you're looking at a $23 increase proposed for that premium class. Again, this is all pre-tax increases. And so they will see the net tax effect would be even less than that. And so we do always like to point that out as well. On the next slide, you'll see the employer portion. As you can see, we are going to carry the heavier load of the increase on the school board side. And so on an employee-only plan, the school board will be picking up an additional $31 as opposed to the $550 that the employee would pick up. And then all the way up to the employee and family, we will be picking up about $69 a month increase per plan for the employer portion as opposed to the $23 that the employee would be picking up. And so there still is a significant, the school board would be picking up the bulk of this increase. Yes, sir.
We have three options on this last item. One is to make a motion to retable this agenda item to give us the option, time to get the other option through. Number two, a motion to pass the agenda, or make a motion to postpone this agenda. So I'm asking the committee if they would give us more time till the 18th and retable this item as an option to having the premium increase on our people. Do I hear a motion? One of these three.
Mr. Chairman, maybe I misunderstood, but I thought we would have to postpone. To table it would render it moot. So I'll be happy to make the motion that we postpone until the 18th.
Yeah, that's fine. That's fine.
Yeah.
We have a motion to postpone this item number two until the 18th. Do I have a second?
Second.
The second that we postpone, first motion and second. All in favor? Thank you. That item passes. That concludes our meeting of this.
Can I ask one question?
Yes, ma'am.
Do you have the retirees broken down that you could give us those numbers? Even if they're not on the screen, just do you know the numbers? Of their part?
The retirees without Medicare, I didn't have a chance to look that up
Okay.
Before the meeting. The retirees with Medicare, they don't pay
Right, they
anything
don't pay.
for their
Right,
health.
right.
So they would see that small increase on the dental that we were talking about, which is $1, I think, for them if they're an employee and spouse. But the retirees without Medicare, I can get you that number right
That'd
after
be
the
great.
meeting. Yes,
Thank
ma'am.
you. Okay, that was my question.
Some that were hired before 87 have a slightly reduced rate.
Right.
Or reduced rate, but the bulk of them,
I knew that was before 87, that they were not the same amount, so.
So, and it's very important that everybody realize that the greatest benefit to the plan is trying to get the retirees that are eligible for Medicare to enroll and maintain Medicare. Because they pay such a huge portion. The volume of drug costs differs between the two is astronomical.
We're going to have to come back because there'll be something to it as a committee.
They pay the bulk
Yeah,
of Medicare.
I have another committee meeting, yes.
I know a lot of retirees that both worked and retired from the school system, so they're not even eligible. And they look at it as a double hit, because they're both, I've heard from, some retirees.
Here, I just wanted to be clear, when Mr. Bachhaus asked if that was our only option, and then we kind of rephrased it as it's the easy option. It's not the only option, is raising their rates, is that correct?
I didn't say it was the easiest option. It's the one that's going to be the least impact to the benefit of the employees. So, for instance, we could raise deductibles. We could raise copays. We could to minimize the cost on the plan. We could charge. We could change other factors. So it's not that it's the easiest one. It's the one that I really do think is the best choice for the board and to maintain the integrity of the benefits that the employees are getting. Because I can tell you right now, what I hear from the employees and myself, I love our health insurance. I love the benefit that I can get out of it. When I compare my rate to anybody else, I love the rate that I have. We're not trying to put ourselves at a super high rate or any of that. We're really just trying to maintain the solvency. And I don't want to remove the benefits. I don't want to reduce even more the drugs will cover. I don't want to reduce even more the amount that we'll pay your doctors. You know what I mean? There's other things we can do, but it's not as palatable because it affects the direct benefit to the employees.
Roughly, have you figured out what's the total? Was it like $6.4 million total?
It's actually about 2.6 million. The board paying $2 million of it, and the active employees, retirees paying a total of $600,000 over the year.
Okay.
Okay, so the 6 million is coming from, that's the deficit. Right now, we're in the hole.
Right.
The last fiscal year.
Yes.
And again, we put an increase in last year, and we're monitoring this. We're trying to make sure that we don't go up too much. And when you look at this 5% increase, again, it's more palatable because 80% of that is funded by the board. If we were to put it in deductibles or put it in out-of-pockets, that's 100% funded by the employer.
Right.
Correct.
And we did 2 increases last year, right?
No, we did one. We only did one increase.
Okay.
We did one increase, and it was approved in January, and it went into effect in March
We
for the
implemented
employees.
Save-On program to
Okay.
take effect.
And the $2.6 million, we don't have that we can absorb that to keep passing it on to the teachers.
Well, you can, but again, the funding of the plan, if it's 80/20,
Right.
it's 80/20. If the board wants to fund 85% and the employees fund 15%, then you just change the.
Well, and I get it, but if we don't have the money, that's a different story. But if we have the money, that's also a different story. And if we can keep from passing it on to the teachers for now, I'm not saying forever, but if we can keep from passing it on to the teachers for now.
That, I can tell you that is an option we could discuss if that's something the board would like to discuss. It's not something that Bossier Parish has ever done because, again, we try to use the premium to fund the plan. There's only one source that it could come from, and that source would be general fund, which, again, that directly impacts anything we can pay to the employees for raises. It affects anything we could pay for supplements. I mean, that's what we tend to use our excess general funds for. And that's our only really unrestricted source that I could put towards this purpose. And so then you've got a toss-up of, you know,
Right.
do you want to commit that money to this purpose? Which is, again, it's board decision, but then we've directly impacted our ability to pay any possible future raises or supplements.
Which we haven't given raises, right? So,
No, sir, we gave raises.
well, we adjusted the pay schedule, but that wasn't given, on paper it came out as a raise, but as far as giving the teachers raises, not since I've been on the board. Next question is, you did say the other day, we have money that's allocated for other stuff. Technically, we could unallocate that, is that correct? Some of it, not all of it?
Yes, sir, certain portions, yes,
So
sir.
certain portions we could unallocate to take care of this in regards that, we have plenty of money, it's earning interest, we can recoup that money that we take out or unallocate. So there are multiple options away from raising deductibles, and also from raising the premiums.
Yes, sir.
Okay, that's all.
Mr. Buckhouse?
What you and Jason are talking about. At location I used to work at, a young lady stayed employed for 44 years until she reached Medicare time because it was too expensive to pick up the insurance and retire early. So she worked for 44 years. So
Yes, sir.
I agree with what you're saying on the good quality insurance that we have.
Ms. Bamberger, I appreciate your comments about the benefits, because benefits aid in retention.
Yes,
And if
sir.
you keep the people who have, we're not giving them pay raises, we need to give them good benefits, the greatest there is. Appreciate
sir.
that. This concludes the meeting of the Insurance Committee. Thank you all for coming. We'll have another before the 18th. Thank you.